thing. This isn't woo-woo magic. And if he walks out of there and it works, now not only is he a believer, his wife's a believer, right? And that will continue to stack up in millions and millions of people. And those data points also become evidence.
What is proof? Okay, what is truth? What do you trust?
The common belief is that there is no research. Well, first off, that's not true. There's a great deal of research.
Many treatments have been neglected because of economic reasons, not just because of medical reasons.
But the business of medicine has really disallowed any free thinking because the model that was created, which was a pill for an ill, was working tremendously well for the investors.
Healthcare payments are keeping many local residents from getting the treatment they need.
37% of Americans go without recommended care.
Your statement says, please pay $220,850.
Sure.
The amount she owed, more than $40,000.
I'm not a human to them. I'm a dollar sign.
The average cost of treatment for patients rose to $63,000.
$17,000 for a lab test, $50,000 for a stay in the NICU.
From $18 a tablet jumping to $750 a tablet.
About 34 million Americans know someone who died because they couldn't pay for medical treatment. You have surgery and you get a medical bill 6 months later saying you owe thousands of dollars.
We have to do something about the price of health care.
It's a right in our country and we should have a right to health care.
Justice in healthcare. Justice in healthcare.
Our healthcare is in a crisis. This bubble is going to burst.
Welcome back, or welcome for the first time to the Breann Bear Show. I am so glad that you are here. Today, we are going to dive into a pretty controversial but incredibly important topic, no matter which way you slice it. I do want to just let you know that I am totally Switzerland about this. I am bringing arguments from both sides, essentially, but from what I'm seeing in the creator space, I have had some questions in my own mind arise, and I feel like some things do need to be addressed, specifically from anti-MLM.
I don't know, they should probably talk to a doctor. This sounds something you need to work through with a licensed professional.
The truth is, both sides have their pros and both sides have their cons, and both also have their fair share of human error. Allopathic medicine, the pros of this approach are that it's backed by scientific research and has a proven track record of treating and curing illnesses. Doctors and medical professionals undergo rigorous training and education to become experts in their fields and their specializations, and they have access to the latest technology and medical advancements to help them diagnose and treat their patients. On the other hand, allopathic medicine does have some cons, as you already know and can imagine. One of the biggest criticisms is that it often focuses solely on treating symptoms rather than addressing the root cause of the symptoms or the problem. Additionally, some people argue that the overuse of prescription drugs can lead to harmful side effects and has contributed to the American opioid epidemic as we know it. For some reason, when recording this, I kept meaning to say conventional and I kept saying traditional. So anyway, that's how my brain works sometimes. Then on the other hand, there is alternative medicine. Complementary alternative medicine, some people refer to it as CAM, homeopathy, functional medicine, like massage, for example, that would fall under this umbrella. Acupuncture, chiropractic care. The pros of this approach are that it takes a holistic approach to health and wellness and emphasizes the importance of treating the whole person rather than just the symptoms. Alternative medicine does have its cons. Critics argue that many alternative medicines lack scientific evidence to support their effectiveness, and that some alternative practitioners may offer false hope and even dangerous treatments to vulnerable patients. So recent studies have shown new advancements in herbal remedies, like how a Japanese herbal medicine protects the gut against inflammatory bowel disease. That was on rats, and the study needs to be completed on humans. I just think that it's great to point out that there are some of these remedies being studied, although they are being studied in Japan and not America, which brings me to a quick question that I think deserves some consideration. Why do you think there is such little clinical research when it comes to naturopathic or alternative medicine or CAM in America? There are some case studies and some research that demonstrate the effectiveness of complementary and holistic medicine in treating a variety of conditions. I gathered this information quickly on a website called Consensus. I didn't dive super deep, but I did find some. A 2018 study published in the Journal of Alternative and Complementary Medicine found that acupuncture was an effective treatment for chronic pain. The study included over 20,000 patients that showed acupuncture was associated with significant reductions in pain severity. And another study in 2017, published in the Journal of Family Medicine and Primary Care, found that a combination of yoga and meditation was effective treatment for hypertension. The study showed that just after 12 weeks of practicing yoga and meditation, patients experienced significant reductions in blood pressure and improved overall cardiovascular health. In 2015, a study published by the Journal of Psychiatric Research found that mindfulness-based cognitive therapy was an effective treatment for depression. The study showed that just after 8 weeks of mindfulness training, patients experienced significant reductions in depressive symptoms overall and improved mood. A 2014 study published in the Journal of Clinical Oncology found that acupuncture was an effective treatment for chemo-induced peripheral neuropathy, a common side effect of chemotherapy. The study showed that acupuncture was associated with significant reductions in CIPN symptoms, such as pain, numbness, and tingling. These are just a few examples of studies that demonstrate the effectiveness of complementary and holistic medicine treating a variety of conditions. All forms of care should be passed through your medical doctor or a licensed healthcare practitioner. Next, let's chat a bit about the integrative medicine approach. Integrative medicine is an approach to healthcare that combines allopathic medicine with complementary alternative therapies, such as acupuncture, mindfulness, nutrition, meditation, Reiki. The goal is to treat the whole person, taking into account their physical, emotional, and spiritual well-being, and to use a personalized, custom treatment approach. Integrative medicine is becoming more and more popular as people look for ways to improve their health and wellness. And the good news is that Western medicine is starting to lean in. Many doctors and medical professionals are recognizing the benefits of incorporating complementary therapies into their practices and are even working with alternative medicine practitioners to provide a more holistic approach to care.
When you're sick, medication or even surgery may be just what the doctor orders. Dr. Adam Perlman, an integrative health specialist at Mayo Clinic, asks an additional question.
What else can we do to really improve our sense of well-being?
That's where acupuncture, yoga, or Tai Chi may be integrated into an overall plan of care. Dr. Perlman describes it as
really helping people to go beyond the treatment of disease and pathophysiology to really a place where they are optimizing their vitality.
Evidence shows, for instance, that acupuncture can help with chronic pain and may be recommended to those with cancer, chronic fatigue, and fibromyalgia. Tai Chi helps with balance and reduces falls in older adults. Yoga may help reduce stress, lower blood pressure, and lower your heart rate. But Dr. Perlman says it's not just what you do with your body that's important.
Other things that tend to impact our health and well-being are things like gratitude and relationships.
For the Mayo Clinic News Network, I'm Vivian Williams.
With this shift toward integrative medicine as a whole, when it comes to this Western medicinal culture that we're used to, it is important to always keep in mind that both sides do, again, I will keep saying it, both sides have their pros and both sides have their cons. And I think that's why integrative, meaning you're taking some from here and some from here and using both, that is the most well-rounded. Allopathic medicine is a afterthought, if you will, and complementary medicine is a forethought. So that's a really good metaphor kind of thing. That's how I think of these two kinds of medicine is preventative forethought medicine and reactive afterthought medicine. Why is it, in my opinion, problematic for creators especially in the anti-MLM or anti-scam space, to be addressing healthcare in this way? Well, the way they talk about accessing healthcare or going to the doctor, the implied ease, it reeks of privilege. It reeks of privilege. Okay, and let me explain. Don't take that to heart. It's harsh, in my opinion, because some natural treatments for some people are actually going to be cheaper. A massage, for example, may be cheaper than someone's muscle relaxers or pain medication. Medicines are incredibly overpriced and are actually 100% inaccessible for many.
Time went on, I got worse. I would have to do injections, and injections aren't cheap. I'm not gonna lie to you guys that one injection that I need to take is $600.
You know, healthcare costs too much. We're having to pay too much because it costs too much. We're perhaps using it too often or not using it correctly. There's a lot of focus now on the drug companies, and drug prices are, of course, very, very high, and something clearly needs to be done about it. When drug companies are only funding 5 to 10% of your budget, it's a lot easier to speak out about something than when they're paying a far higher amount. They say that they represent patients, consumers, but they never say anything about drug prices because they're getting so much money from the drug companies. The other things that resonated for me the most when I started covering healthcare was seeing the list of the countries that spend the most on healthcare and the countries that have the sickest people. And we spend the most, and among the developed countries, we have the sickest people. So there's got to be a better way to do it, and one of the things the other countries are doing much better is offering social services.
There is no universal health care in America in 2023. More than 30 million Americans are uninsured as of 2021, and I'm sure that number has not decreased any. Keep in mind, these are reported numbers, so imagine how many unreported cases of uninsured Americans or non-citizen Americans exist in this country today. Out of all of the states, Texas has the highest rate of uninsured individuals, coming in at 18%. 30% of them are Hispanic, and 14% are Black. The lowest numbers of uninsured individuals are Caucasian. Who would have guessed? Considering those numbers, we have to safely assume that immigrants are not being insured in most cases, because you need a social security number for citizenship and for coverage. That is not to say that they are totally cut off from healthcare access, though. Undocumented immigrants may be eligible for emergency medical treatment under the Emergency Medical Treatment and Active Labor Act, or EMTALA, which requires hospitals that participate in Medicare to provide emergency medical treatment to anyone who needs it, regardless of their immigration status or ability to pay. Additionally, some states have implemented their own programs to provide health insurance coverage to undocumented immigrants. It is worth noting, though, that even in places where there may be access to healthcare services for undocumented immigrants, that doesn't mean that they're going to take them up on it. And here's why: because healthcare workers are mandated reporters. Laws require certain professionals to report suspected cases of abuse, mistreatment, neglect, or infectious disease to authorities. It is a legal obligation to report, regardless of the patient's immigration status. So that is a huge fear for undocumented immigrants. So one major issue we see in America when it comes to healthcare is marginalized groups do not have equal access, whether they are citizens or not. Marginalized groups may be more likely to live in areas that have limited resources, such as low-income areas or rural areas. There are language barriers and often cultural misunderstandings that make it difficult to access or receive quality services. Discrimination can also manifest in the form of implicit bias amongst healthcare providers, which can lead to misdiagnosis, delayed diagnosis, and inadequate treatment. They may also experience discrimination in employment or education, or have a lack of access to employment or education, which limits their access, therefore, to healthcare services. I will expand on this in another video to come soon. In America, You see a doctor or a provider, maybe a nurse practitioner or a physician's assistant. They prescribe some kind of testing or treatment. Well, all testing and treatment has to have somebody to pay for it. Even if it's TED hose or urine testing, if you're in a recovery program, somebody has to foot the bill for these tests to be performed, for them to be interpreted, and for the treatment that may ensue. So that's where insurance companies come in.
We have these government regulations that really change the way that the hospitals and the doctors and the practices think about the patients. Because if a patient's only paying 10 cents on the dollar and a hospital's getting reimbursed by the government or an insurance company, then the patient is no longer the client. They're no longer the payer. And so instead of the hospital or the doctor treating the patient, they're thinking of billing, and they're thinking of the businesses, and they're thinking about the insurance companies.
Ultimately, you are a patient of the payer. They make the ultimate decision in your healthcare. And if you're a cash pay patient, your decision comes down to what is going to save you the most money and what can you actually afford in the moment. So therefore, your access isn't equal either. So does anyone have good, equitable access to healthcare in America at all? That's a good question. I was recently watching a true crime show, big surprise, but it's called Disappeared. And there was a woman who had been diagnosed with bipolar disorder, who needed some medication, had gone to her doctor, taken all the right steps, was being seen by a therapist or a psychiatrist. Somebody had prescribed her a medication. There was an issue with her getting the correct medication. Insurance wouldn't approve it. There was something in the way. Her husband says, I will pay for it out of my own money. Like, I will pay cash for this medication. The insurance company says to him, if you pay cash for that medication, we will immediately penalize you by dropping you from our plan. So this poor lady, who had been struggling immensely with symptoms of bipolar disorder, her circumstances were incredibly up and down because of the states that she would go into. So she ends up going on a bender. She goes and buys a bottle at a local store and was never seen again. No one was ever charged for anything. There was no body ever found. She just seemingly fizzled off into thin air. And I remember thinking, man, that is a hard one to process, because had she had access to that medication, would those kids of hers still have their mom? In my opinion, the insurance company should be held liable for her disappearance, but are they ever held liable for anything? The sad part about that story, y'all, is it is the story of so many people suffering with illnesses, not just mental, but physical disabilities, illnesses, diagnoses, autoimmune disorders that have medications that they cannot afford, that they don't have access to because of insurance issues, because of income issues, financial issues. There are so many people, especially in this country, that suffer every single day because they just cannot get what they need. I remember when I worked as a nurse on rehab, this was an inpatient rehab, and we would run into a lot of issues with insurance when we would go to start transitioning people into a discharge home. Not all people went home from rehab, but some did. It seemed like there was always an issue coming up. The case manager was always behind closed doors in the back office somewhere, fighting tooth and nail with insurance companies just so that these patients could go home with occupational devices, like the little apparatuses you put on a toothbrush when you can't close your hand all the way. It would just be like something you wrap around a toothbrush to be able to brush their teeth on their own. They would have these different kind of shoehorn type of things that you would put between your heel and the shoe to help you so you could put your shoe on by yourself. So these very seemingly small things that we take for granted every single day, there are occupational devices for a lot of these things for people who have, for example, had hip surgery or had a traumatic brain injury or a spinal cord injury, and they just can't move the same way that they did before. These people would sometimes go and be discharged home, and they needed home health care, but they couldn't have that because insurance wouldn't pay for it. They needed ramps, wheelchairs, urinals, hospital beds, bedpans, and they would have to either pay out of pocket for it, and most of these people did not have the funds for that because they were injured. They couldn't work anymore. I also at one time worked with veterans. Like, you would think they would get the best treatment from the VA. The VA was typically a whole show, y'all. So when people turn their nose up at complementary alternative medicine, holistic healthcare, whatever you want to call it, functional medicine, functional nutrition, massage, Reiki, acupuncture, whatever it is, when I see people turn their nose up at it, call naturopathic doctors quacks, and say rude and raucous things toward an entire industry that is helping some people, it makes my stomach turn. There is such an air of elitism and classism in some online spaces nowadays. It's almost like the ones doing it don't even realize that they're doing it, because if they realize the level of contradiction and hypocrisy in their ways, they would be embarrassed by it. Think about where functional, holistic, homeopathic, naturopathic medicine originated. Off the backs of indigenous people. Even midwifery, which has been heavily colonized, originated with Native American women and Black women who were brought here by the settlers. Think about how those two realms of medicine have been looked at over the years and where they originated. Is that just another instance of institutionalized systemic oppression? I think that people should be very, very conscious of what they say, because there are a lot of people of color who are very, very spiritual people and who do practice a lot of cultural ceremonies, traditional ceremonies they are sacred ceremonies. And they also practice a lot of herbal and homeopathic medicine. I can't imagine if someone looked at a Native person and said, what you practice in your ceremony isn't backed by science, so you shouldn't do it. And I think not just considering indigenous people and people who started using herbs and such in ceremony, but also considering other groups of people like neurodivergent people, for example, who maybe have accessed the healthcare system for various things and haven't been able to find a medication that works for them. They have not found adequate treatment out of all the treatments that exist, and they are leading a very poor quality of life. I think about women who have been absolutely traumatized.
I became sick with this mysterious illness. One of the doctors, I'm a nurse, I was completing my bachelor's degree and I could barely even think, have any memory, short-term memory. I went to an infectious disease doctor that treats at the hospital where I worked, and he basically looked at me and told me I needed to go see a psychiatrist, that all my symptoms were in my head.
You have to fight tooth and nail to prove why you are actually sick or why you are actually this and that, and then you have to prove that you did not do it to yourself.
When I got diagnosed with cancer, they fired me, and that was from a health institution.
So do we know everyone's trauma now? Where we can just assume that the reasons people access other forms of healthcare are because they don't like science? It's crazy to me. It's like some people have just never gone through. Because when you've gone through and you have been institutionalized, you understand what makes people think the way that they think and go the opposite way and kind of turn into nonconformists, and they want to do the total opposite of what everyone else is doing.
I lost my 17-year-old daughter to suicide on March 28th, 2017. The runaround that we received so many times throughout her illness, which went on for, a good 6-7 years, was depressing. It was frustrating, and it's just not where we need to be. Some of the things that went on, it began at the beginning with her seeing a psychologist, her seeing a doctor, and of course, was prescribed medication. It never failed multiple times that once she would get on a medication that was actually working, insurance would say, well, now you need to change it because it's too expensive.
Overweight patients or obese patients who are often not treated fairly within the Western medical system and are not treated for their actual symptoms because doctors are attributing their problems to their weight. It could be a toenail that isn't grown, and the doctor could say, lose weight, come back in 2 weeks. Obese patients are very, very often dealing with health biases from doctors because of their weight. They may be more inclined to seek out a functional or natural medicine practitioner or whatever. And lastly, what about people like me who walked in to a doctor's office, a normal, young, almost ready to graduate with a professional degree, talented, smart, single mom, who walked into a doctor's office with ovarian cysts and walked out an addict. The very hands that were supposed to take care of me were my very first drugs. Or what about the families of the roughly 1 million who we have lost to drug overdoses? Do you think they trust westernized healthcare? Do you think they trust Big Pharma? We all know who facilitated the opioid epidemic, right? Okay. If we have the outlook of functional medicine doctors and practitioners are all quacks and shouldn't be allowed to practice because they're not recognized by the AMA, we are eliciting gender, race, ethnic, cultural, financial, socioeconomic, classist elitism, in my opinion. It mirrors the extremist beliefs that are often associated with MLMs, like anti-medicine, anti-pharma, anti-intervention narratives that many CEOs and leaders alike promote. Because if you are touting an all-or-nothing medical approach, you are unfortunately being biased toward the people who use both. When it comes to your body, I think you should do what you see fit and scientific for your body. But you should leave other people's bodies and choices out of it. Because again, you have no idea what kind of trauma or what kind of life they have been through. I do know that the medical community is improving slowly, but surely. The intense scrutiny on the medical community is finally coming to a head, and we're really starting to understand the effects of the healthcare system on people's health since you know what hit. I do believe it was one of the worst times ever, but it was also helpful in many ways, and I'm not bypassing the impact that time had on everyone and everyone that we lost. I'm implying that it woke a lot of people up to how insanely important it is to take care of the vessel that we were given, and not just to take care of it when we are faced with a symptom or illness, but to take care of it beforehand so that it doesn't come to that. Any person who focuses even a little bit on prevention or illness in any way is taking a functional or alternative approach. I do believe that as more and more people become more involved in their own treatment and care plans and just involved in their own health, period, they will start to seek out alternative and complementary medicine and holistic therapies as well. More and more people want to be seen as a whole person and not just labeled as their diagnosis. And we should be allowed to support, use, and defend whatever we so choose as long as it is not harming anyone else. If someone is spreading harmful narratives about either side, I think that's on them. It says so much more about the person saying those things than it does of either profession, whether allopathic or naturopathic. I do believe that evidence-based treatments are important. I was trained in evidence-based approaches. I heard the phrase evidence-based at least 3 or 4 times a day in my classes, on the floor, etc., etc. But I am not naive or privileged enough to think that people haven't been harmed to the point of no return, literally, in both realms of medicine. And I may not be pro-MLM anymore, but I know one thing. I am anti-harm. And I take that very seriously. And unfortunately, I'm still seeing a lot of harmful narratives being promoted through the anti-scam and anti-MLM communities. So I hope we will stop the divisive rhetoric and instead focus on what's important, our own health and well-being, whether we choose allopathic medicine or alternative medicine. Let's remember we're all in this together. And we're all here just doing our best to live our best lives in unprecedented times, and that is going to look different for all. As I sign off, I want to make some recommendations for you for some really good TV shows and movies to watch that are related to this very subject. The first one is called Dopesick, Dopesick. That is a series on Hulu. The next one is Oxymorons. This is a Boston-based movie. And if you are from New England, you will absolutely love it, even though it is incredibly sad and terrifying. Crime of the Century on HBO. I haven't watched it, but it is about the opioid epidemic. Crisis on Amazon, I believe, is about the same thing. And Dead Ringers on Amazon, which me and my husband are currently watching. That is about two twins who are OBGYNs and are building their own practice and doing some absolutely wild things with embryos. So anyway, it does address some serious things in healthcare that I talked about today. So please make sure to send this to someone that you know who would also find it interesting. Regardless of which avenue someone chooses, integrative, purely allopathic, or 100% alternative healthcare, we have to remember that in order to truly be open-minded, accepting, and forward-thinking, we must keep bodily autonomy a priority. Many women in this anti-scam commentary / reactionary creator space have been in commercial cults and or, at the minimum, high control groups, and we've been trained to have black or white thinking. I just don't think it's right for anyone to push that onto other people. I was hoping someone else would stand up and say something, but again, no one did. I personally take medications every single day, and I depend on my NP heavily for a lot. I also find solace in mindfulness practices, not just for ADHD, but also for a better relationship with food. Meditation and mindfulness helped me a lot in healing that part of myself when I started my health journey in 2018. I've also been noticing in my personal trainer schooling that there is a lot of focus on the person as a whole, not just their fitness. And I'd say as a profession, it overall has a pretty holistic approach to wellness. I never want anyone who takes in anti-scam or anti-MLM content to feel left out, like what you're doing is totally wrong, or to take someone's thoughtless words to heart. I hope this video provides you with some insight into healthcare as a whole and why both sides can be helpful, while always keeping in mind that it is important to use allopathic healthcare even though the system is hugely flawed. We don't have much of a choice, especially someone who is neurodivergent like myself, and I know a lot of you watching this are. Always take care of yourself and do not let anyone's harsh judgment change how you do that. Just always do it safely and make sure you are advocating for yourself always. Also, if you ever have trouble accessing healthcare services in any way, call 211 and I will leave a link in the description for you. I appreciate you. Thanks for coming to the Breann Bear Show and goodbye.